At the Composite helicopter unit in Goma, DRC, the South African Military Health Service has a Level 1 hospital. DefenceWeb had the opportunity to interview some of the doctors from that hospital.
Our primary mandate is to do medical evacuation, like it's AMED stands for Aeromedical Team Evacuation, yes. So that's what we are basically doing, moving patients from one facility to the next. I'm from 3 military hospital in Bloemfontein. I'm stationed here in the DRC. I'm with AMED Team 1 at Goma. I've been here for 3 months, going for the 4th one now. Because we're moving patients that have been stabilized before. It's different from doing a CASAVAC. CASAVAC is when you're extracting patients from the bush, those ones who are fighting force, you know. With us, we're moving those that have been stabilized at level 1. Those are the field hospitals, and then we have to move them to the next facility. And we see trauma cases, we see medical cases, like the last one we did was a patient with a myocardial infarction. So we had to move that patient from one of the villages, Bukavu, to Entebbe, which is Uganda. So far we're almost at 70 medical evacuations. I haven't had the worst, but I've had my fears. You know, like when we have to move in at night and go and extract the patient from the surrounding villages, you know, so you sort of wonder of the security, the flight is dark, you know, but you have a faith in your pilots and everything. But we also are getting security. We're being, before we can go in, they ensure that the place is secure before we can fly off. But that little fear is still there.
Sure.
You don't have time.
Yeah.
And when the aircraft land, you scoop the patient and you go. The other stuff, you do them inside the aircraft.
And that is a very challenging thing, to put up drips, to listen to their heartbeats and everything. You can't hear anything in the aircraft. So you just have, you know, to be on the ball. But it has to be done. Yeah.
I've been here for 7 months. Yeah, but I started working in Beni. I worked in Beni for 4 months, and then now I'm here in Goma.
I think Goma is relatively stable, but the people in Beni, that's where that kind of action is.
For me, the busiest month is when I was in Beni, because I had an opportunity to work both in Beni and Goma. And Beni is the most volatile area, so we saw a lot of patients. Sometimes you lose count.
Okay.
Different type of gunshot wound. Sometimes it's injuries from bomb explosions, gunshots, AKs. So it's different types of gunshot wound. Sometimes we even assist small kids as young as 6 months from machete wounds, gunshot wounds. So we see locals as well. So it's quite sad, but it's a lifetime experience. I've learned a lot. If I wasn't here in Congo, I don't think I was going to experience that at home in South Africa. Because in South Africa, we work in a hospital-based setting where everything is around you. But here it's quite different. You spend most of the time inside the aircraft. Some of the patients, you must resuscitate them inside the aircraft while the aircraft is flying. And it's a difficult working condition. We are in Goma, and then Beni is close to Lake Edward. It's in the north, close to the border of Uganda.
Okay.
So the team that is in Beni sometimes evacuate patients from the surrounding area, and then Goma team, we go to Beni, fetch patient, and then sometimes we take some of the patients to Uganda, or we take them to the eastern part of DRC, Kinshasa, depending on the severity of the case. If it's a case that needs a higher level of care, we send them to Uganda, level 4 hospital, Kinshasa, because we have level 4 in Uganda and level 4 in Kinshasa. Some of the case we take them to level 3 here in Goma, and if it's a Congolese FRDC soldier, we take them to their level 3, which is in Goma. Some of them we take them to level 4 in Kinshasa. When I was in Beni, they woke me up at around 1 a.m. We had to go and evacuate patients in a village at Bigado. The area was quite volatile. We left Beni to Bigado with some of the Tanzanian platoon. We had to evacuate WHO members, staff members who were shot. The Ebola treatment center was attacked, so we had to go to Bigado and evacuate those patients.
I'm just proud of my team, myself, and my country. This is a life-changing experience, very, very profound.